Welcome to the Beauty Beyond Bella podcast. I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Hi, everyone. So I am with my bestie, Kerry McDonald.
Hello.
Beautiful friend of, over 20 years now, and also the amazing master injector over at Bella with me here, and we love having her here. So there's so many things I like to get into at Perry, it's kind of fun. We like to razz each other a lot, and I really love, it's just like about a little bit of everything. One, how to get into this field. We get lots of questions. She gets bombarded every day. It's a really hard field to get into, from everything to the new trend of looking more natural, and how we kind of do our consultations and what you should expect when you're here. So welcome, Kerry.
Thank you very much. This is fun. I love doing this.
And so y'all get a little strapped. So look, I think that we have a very natural approach at Bella when we look at someone. And hopefully when you look at us, that we look very natural and very youthful, and that there's a really good trend going that way. I think you remember back in the day when we first started that the trend was very different, and what we saw. Tell me how you're kind of trying to make sure that our patients keep going into that more natural look.
Well, I'll tell you a story. And you remember back in the day, a certain company, or name names, was training providers how to do Botox injections in the forehead. And you remember many years ago, and I'm sure a lot of people will remember, how we got that downturned angle, and you could tell people had Botox because they would have those peaks on the side, or we call it spot brow. And they actually, were growing, the industry's growing, but also, the companies that are bringing on providers and doing training have learned through trial and error of folks like us of how to actually inject. So, for instance, they used to say, we won't mention any company's names, draw a line from the mid-pupillary line straight up and treat the frontalis between these two lines and leave the lateral frontalis out in the wilderness. And it would give you a heavy look, and it would arch this spot brow. So a lot of times people say, I don't want that. Well, we've gone 50 ways to Sunday in the way we treat just the forehead, for example, to keep it lateral, feathered out, having your brows movable, lifting up evenly, just different things like that. So, I think the industry has had, trial and errors of how they trained providers. And I don't think it was necessarily their fault back in the day, because that's how they were being trained. And then they learn how to overcome that. And then you adjust over and over and over again.
Yeah, I agree. I think for providers out there watching, the two main things that would probably cause you to have a spot, like Harry was saying, is we're either not going far enough lateral, and we're not, helping that levator muscle to kind of relax. And sometimes, and I'm not quite sure why that trend started in the glabella, that they're not treating the lateral part of the corrugator.
Right.
And so they're getting this really weird downturn and then this really high spot. Versus, look, we all want a little bit of movement with absolutely no wrinkles. That's the goal is to be a little bit more rounded, more youthful. Yeah, and I agree. It comes full circle. I think when I first started injecting too, the goal at that point was everyone only received nasolabial folds and lips, and that was 20 years ago. So I'm dating myself a little bit. And now we're really talking about full correction, rejuvenation, peripheral injections, right? Framing that face. How do you talk to patients about that? Because sometimes they don't see that, or maybe now the social media, they do see their profile more often.
Yeah, so that's very common. And I always tell my patients, when you are looking at yourself in the mirror, when we look at ourselves in the mirror, we're always focusing here. We don't gaze into our own eyes in the mirror. But when other people are looking at us, they're looking in the windows of our soul. They're looking at your eyes and the frame of the face. And so a lot of people will come in thinking that they want this area, and they're kind of hyper fixated on this area. But what's actually going to fix this area is not filling this area. And the nasolabial folds, most often now, coming full circle from a long time ago, are the last thing that you want to treat. You have to correct all of the aging processes, the bone loss, right? Your skull is getting smaller, your chin is receding, and the bones are getting less dense, and you have the same surface area of skin. Then you go into the next layer, you have fat pads that are kind of metabolizing and shrinking at different rates. I mean, we could talk about you with your one side that's perfect for 3 years. So all right, yeah. So it's just knowing how to educate people and saying, okay, this is the manifestation, but the actual cause is a lot of the fat pads that are being lost in front of the ear, the bone loss. I mean, we actually lose our lateral brow bone. They used to be this long, and as we age and we're in 40s and thereafter, our little brow bones were this long, now they're this long. And so that skin on the lid, when you feel like your eyes are heavy, they don't have that little window and that structure and that framework hold it up and out. And then you add your fat pads over here in your temples, which, temples are a big thing, but we've been doing temples since 2011, off label, to be honest. And those fixed points, we call them, in the back of the face here close to the hairline are what actually pull things up and correct in these labial folds. So people just need to be educated on what is happening to their face.
Now, I agree, right? We talk about the 8-point direction. Like, so when we're stabilizing it, and like we all do it, right? We all wake up and we all go, I just want this. Like, we all feel like we look better with doing that. And if you look, where are your fingers at, right? And they're at every. They're at our temple. And when we do our temple and that smaz, which is our fascia, is coming all the way up and it's so tight. When you start to improve that, you really do get this lifting approach from our temple, in the lateral cheek, the posterior jawline. And then back to the day, we didn't really even know about ligaments. We know that our ligaments tighten, they move, they cause this vertical line that's coming down our face. And so it really is, and we try to spend a lot of time, I think, educating our patients. Maybe we over-educate. But sometimes, ask me, I'm the overeducator. You're a little bit of the overeducator compared to me. I know I'd probably keep it really simple because sometimes patients don't really get it. And they're like, I just need you to make me look beautiful. I don't really care that my fat guys are shrinking and I've lost 1,000 pounds and I need this redone, right? Yeah. They don't want you to spend 30 minutes and telling them all about their anatomy. Or maybe they do.
Sometimes my patients have a choice into therapy. To me, I feel like I love the direction that aesthetics is going in many aspects. Some not so much, because sometimes there's an oversaturation of people who think that they want to get into this field and they're really not artists. They may have all the anatomical training and degrees and all of the things. They understand anatomy, but they don't know how to place it artistically to make it look balanced. The other thing is the sequence of things. If somebody, let's say, needs a lot of facial balancing, but they have a lot of laxity, they have a lot of bone loss, and you need to address the tightness of the smaz, that's when you start to talk about the skin tightening modalities like all therapy and those kind of things that actually help tighten everything and lift over time in a gradual approach. And it gives you some forgiveness when you're starting to inject in these areas, when you know that the 3 depths, right, your smaz, your dermal layer, and your epidural layer are slowly tightening over time. It's kind of something to look forward to while you're fixing and fine-tuning these little things. So to leave that out is often not the greatest thing. And to know when somebody has a face that's really outside your scope and you need to refer them to a surgeon, because oftentimes they will need surgery, but they're still going to need you after surgery because they still need volume replacement.
Yeah, I agree. Combination treatments, I think, is where our gold standard is now. And it wasn't like that before. I can think of 2 zones that we really can spend so much time in discussing is really the eye zone and obviously the jawline with some momentum, right? So into that sagging neck. That does not only require injectables. There really has to be a modality with devices, right? Because like we try to tell them when they come in with fat head and we need to talk about skin technique, how do you like to look and frame the eyes?
Right. So a lot of times, with the eyes, with when, especially now that semaglutide and all the tirzepatide, the GLP-1s are on the scene and people are losing a lot of fat on their face very asymmetrically. And it's actually, we're finding, affecting the skin to a degree. So when I'm dealing with anyone that has concerns about their eyes, I'm very transparent about what is happening, right? Your myelofat tablet's actually sliding out from behind your orbit. And you've got fat pads that are basically, like we talked about previously, kind of you're losing back here. And then your tear trough ligament is actually getting tighter. So you've got a combination of things. Sometimes they want to hear all of that, and sometimes they're like, "It fix me." That's true. But with the eyes, a lot of times I'm doing a tightening procedure first. I'm not the type of provider that's going to say, "Okay, let's put a cannula, let's fill this orbital rim." If there's too much laxity, it's not appropriate. Same thing if you're doing jelly roll tops. If there's too much laxity and they fail the snap test, you're not doing that. So I tell them realistically, are you a surgical case? Do you need a bluff? Or are you a patient person and you can wait for all therapy that's done correctly to kick in? And then in 3 months, we're going to evaluate how tight we got you. And if it's, at that stage, then we're going to do a little bit of cheap, right? Because you get 50% correction, like you can make the cheeks kind of support underneath that orbital ligament. And then it's stage by stage. Then we may put a little bit with a cannula into the infraorbital rim and laterally, but they have to understand that this is not, we're not going to just jam some filler in your tear troughs and then everything's going to blend perfectly, because there's a lot of processes of aging around the eye. The temples, bladder, cheekbones, your fat pads, your tear trough ligament, everything is kind of being naughty when your hormones change, especially for women. With men, it's kind of a different scenario. A lot of times, you have to do more than one treatment of all therapy.
And it's interesting. So I feel like the number one reason men come in for their face is either their tear troughs or the nasal folds. That's where they start to see their aging. When someone comes in and says, "I look tired," that's coming from their eyes. We don't feel awakened and very refreshed looking. And like you said, that's a very difficult area. And I think if people understand that we're trying to do what's best for them, we're trying to make sure it looks very natural and that it's going to be an area that holds. Back in the day, it was easy. We just threw a filler in a tear trough and off they go. And people were getting, some edema. And that wasn't the look we wanted. We wanted a more refreshed, tight look around the eyes that were going to really make them pop. And I think that's still one of the hardest areas to have a conversation with the patient, because if they don't really want to do an entire treatment plan, then that's really going to affect the results that we can give them.
100%. A lot of times fixing the under eyes are all these other things. And it's, it can be pricey. It's a game of patience. And, I have several patients where I'm alternating platelet-rich plasma, then a little bit of filler, making sure I'm keeping up with their cheeks. And, to keep that support, I'm washing her temples, and a lot of times with temples, this is a big space, and it requires more than one syringe. So really it's about making sure they understand the process. And even if they do go and get a blepharoplasty and actually remove some skin or do a fat transfer, filler is still, if they want to keep that look, it's going to potentially be in their future. I like easy gel. I like PRP. I like to alternate, and I like to, see, what the patient is willing to do as far as aftercare, all of those things.
And it doesn't have to be a lab. But we come up with a treatment plan. But yeah, this is the area where we would like you to do A, B, and C, and we'll make a priority and work. People still worry about their budget, but we're here to help kind of correct them, navigate through that, because there are little things you can do. And I always tell people, look, you didn't age like this overnight, right? We don't need to fix it overnight, right? So we can do little baby steps, or I can jump straight in. It really is up to the patient, I guess.
So one of the things I talk about, because I love to correct eyes. Even though there's a series of things that have to be done, it's one of my favorite things. And I always tell my patients, we have different types of filler with different cohesivity. And when we say a filler lasts 1 year, for Volbella's FDA approved from Allergan under the eyes, we use it very frequently. Volbella, we say it is a year-long filler. It lasts about a year. But when you put filler under the eyes into this little tear trough area, you're kind of putting the filler into a closet, because you're kind of popping through that little ligament. So what we're noticing is that over time, research that even though this filler is a year-long filler, it lasts about a year, it lasts longer when you're using it in the teardrops because it's kind of like in a secret little closet that your body just doesn't metabolize it the same way. You're not. So, and the other thing is too, is that I always talk to my patients about, do you have allergies? Do you have, some little micro vessels that are giving you allergic shriners that give you that purple hue? And I warn them, there's going to be some homework on your part. You need to take your non-drowsy Claritin. We live in Florida. There's a whole bunch of whirly irritants that are going to swell up your maxillary and frontal sinuses, put a little back pressure on those capillaries. So you want to make sure that you're taking your antihistamines, your nasal sprays, you're doing your part to calm down any extra edema under there. Because when we put a little filler into there, your little lymph nodes are like little diamonds on the side, and we want to make sure that there's no hindrance to be, if you're swelling from salty food or any of those things, that you're actually able to decompress that fluid and that the filler is not going to be problematic in that area. So there's a lot of education with the eyes to make them look the absolute best.
Yeah, and I love shooting uppers. So I've been on a little plasma kick lately. I think it's because, look, as we age, even the skin up here starts to get a little loose. So what I normally love to do is I love to do that tox with giving a little brow lift. And then I love to do my little flexor all the way around the eyes. I want to jog the upper lid as much as the lower lid. It really kind of helps smooth that out because as we age, our skin starts to drop a little bit on our upper lids. We also want to make sure that this space in here stays high and tight. And so I think that really rams out our eyes really well.
Oh yeah, we have a lot of different things at Bella that we could do to tighten skin around the eyes. We do the metal eye shields. Yes, and the eyeballs, we put those little metal contact lenses in. We can do Era, we can do plasma energy, with our Plexor device, which is like the Ferrari of plasma devices, and it works really well. And then, we have Ultherapy, and we can do a lot of creative things with Ultherapy to tighten the skin, which is a little bit, longer of, a result. You have to have this game of patience, but it's safe. And I love Ultherapy. It's something that, I love my Ultherapy. It's changing the way we yeah, because you're going to change the way you age in the future. That's why I like Ultherapy, especially around the eyes. You're not going to fall. You're not going to drop because you're tightening. That's nice.
Well, I kind of love it for the lower face. So let's pop a. Yeah, it's about we're ogres you. We are. You've been trying to get on the schedule for a couple of weeks. I try to do myelotherapy every year for my lower face. I think it helps reposition that tissue in all 3 layers, right? As we were talking about, it is a wait and see procedure. But that's, I think, what we had that conversation with patients is, again, we didn't get here overnight. Let's do a procedure that is going to improve in 3 to 6 months, not just today. So we both love Ultherapy. Tell me about what else with Ultherapy can we do for the lower face to reposition so that when we are doing our sulfies and looking down on our phone, we don't feel like everything is hanging forward, which is really annoying.
So for me, Ultherapy is a married couple with your platysmal band Botox, and you have to do it quarterly. Like, protect the word, protect the lift. I always tell patients, if you're looking in the mirror and you're doing this and you like that look better, what we can do, because we're not, surgeons, we're not doing deep planars, MAS, neck lifts here, but we can prevent the need for that and stave off the need for a neck and face lift longer if you keep up with the tightening of those vas with Ultherapy. There's other lasers like Morpheus and things like that. There's other modalities, but for me, I really prefer Ultherapy. Ultherapy, you can leave with your sunscreen, go to Target, go shopping, and really nobody knows that you did anything. So there's absolutely zero downtime, and a lot of people need that in their life. And for me, after Ultherapy, I like to keep up with the platysmal band tox that kind of wraps it over the jawline to keep these kind of lifted. And I love to do platysmal bands here. I also like to do hyperdendulate radius, and you can even do little micro droplets of Bellatero on the necklace lines, or any HA really. That's really some molecule like Bulbella to kind of give them something to be excited about while they're waiting for the lift. There's lots of options.
Yeah, there really is. I've been even doing a lot of just little micro kybellas that I saw about little myellar areas just to kind of help that cement some fat going into that little jowling. Like you said, whether it's a little Nefertiti lip with some Botox, whether it's a little Kybella, all of it is to try to help tighten it. But there really is not a one and done. I mean, I've done smooth threads, but every single person, I think, responds a little different. And so really understanding how quick do we need to go to the journey, but it is an area that for sure requires payments. Yes. your face requires makeup. We on your packaged in the whole things. I look at it, well, we still age every day, right? So everything we reverse, if we're not 6 foot under, we're aging. So we're gonna age gracefully. I think that's gonna be the most important part.
I think I would say probably 75% of my patients come in and they're like, hey, nobody is really happy with their neck after 45.
But do you think it's because we treat our face for so long and we forget early on to treat our neck?
That's my pet peeve is when this doesn't match this. And it's true because and especially if you have any budgetary issues, like this is the priority, right? This is your calling card for most people. And, the neck sometimes, even with products, you've got to bring it and you've got to do your décolleté. You've got to kind of make everything blend and make sure that you don't forget about these areas, especially in Florida because we're all wearing, clothes that are more revealing because it's hot. We're wearing tank tops, we're wearing bathing suits, we're wearing those kind of things. So you're starting to age down here. With my patients that come in and they have lots of questions about what they could do for their neck, I have to go into my little educational speaking about, or, our 30 minutes. Oh, let me tell you about the anatomy of your neck. So, and I think the one thing to remember about the neck is that the skin on the neck is meant to be more elastic than anywhere on the body because you're on a rotational joint. So I always tell my patients when they're coming in, they want to say, I've seen platysmal band Botox on Instagram, all these videos. I'm like, okay, well, this is what they're doing. So I explained to that when you raise your head and you basically measure from here to here, right? So you get 20 centimeters, just for example, they have a long neck. And then you flex your neck and you measure from here to here, the same amount of skin, you're losing some of those centimeters, but it's the same amount of skin. The platysmal bands that go up and kind of shadow over top of your jawline, the same platysmal band from here to here is a depressor. And then the same one that goes all the way down to your breast is a levator, so it's pulling up. So when we're treating the platysmal bands, we're trying to keep the lift from here to here, but we're trying to negate the down pull from the depressing part of that platysmal band. So I'm trying to get them to understand what it is we're trying to achieve. And then it's cumulative over time. Just like when you're doing Botox and you're trying to prevent wrinkles, if you atrophy the downward pull over time, you need less and it's a little bit less naughty over time. So if you're doing something like cold therapy or even Morpheus or whatever you chose to do, not as much with threads, but you'll protect your results and keep those platysmal bands behaving.
Always keep them behaving.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
I think another area too, before we get to really what we can kind of see in the media now, I think another area that's a really big concern that we didn't touch on is the perioral area, right? Many people have smoker lines that never smoked. We drink from bottles and we over animate our mouths. And so we think all the time of tops on the upper face, but I think we forget a lot. And I think we're pretty good at educating our patients about the smoker lines, about the pull of the DAOs, about the chin recessing. So as we get older, I always tell my grandma's chin, if your chin looks like this, you have a deep line, right? We need to elongate that. That's also going to help with the neck. But that's a hard conversation to kind of go with people because they think just, I'm going to fill my lips and everything else around it is going to miraculously look better.
No, because sometimes if they just want to focus on their lips, the frame around the mouth is going to be more noticeably off if everyone's like, ooh, look at those lips, but ooh, around. Like, so you have to have that conversation about if we just do the lips, this is what it's going to look like. But perfect world scenario, we need to frame around there. With filler, with, DAO talks. But I always talk to my patients and find out what their lifestyle is going to be like after, especially DAO talks, because, you've got DLI right here. And if they're going to have a pitcher of sangria with their girlfriends or you have any kind of inkling that they may not be compliant, we're not doing this until you're fully understanding that these are small little intricate muscles. And sometimes I'll do like a 0.5 or a 1-to-1 there because I don't want it to spread and I want it to stay in the exact muscle and the exact depth that I want it to be to make it lift and be perfect. So we don't want side corners in Witchy Chin. So we do a little bit here to raise these up and pull that down. I think there's a lot of social media coverage on a lower face, but I think, you know, we're coming around little by little. Like for instance, right now we have 100 units for, you know, our special. And to be honest, I could do 100 units and anyone who's, you know, 40 and thereafter every 4 months. And then we've covered the upper, lower, and the part placenta and everybody's happy. But it's just having that conversation, like, you know, they look at me and they look at you and say, okay, you know, I'm about to be 50. You don't look your age. You're just teen-eyes older. But these are the kind of things that we're doing to kind of maintain what we're looking and to maintain that natural look.
Yeah, I completely agree. And, you know, again, that's an area that's going to require a lot of combination treatments. I personally like to do a little smooth threads on the upper lip. I like to do some plasma devices around the mouth. And again, I think that the theory and the concept is that the combination therapies, a little bit of the tox, a little bit of a filler, a little bit of a device, will really maintain the results also a while longer. This is the first time that I went almost 6 months without my tox. I was quite shocked. I never made it past 4 months. And that's because I've been on a kick with my devices, right? How do I get collagen? I risk giving you with the days for me, do this, do that. You know, I think as we age, and this happens to me every year, December, when it's my birthday month, and we're both Sagittarius girls right here, is we feel like the month before our birthday, we need to make sure that we look the very best that we can and more youthful. And I'm starting to realize, man, I really need to start 3 months before my birthday, right? Because it is not a one and done. It really is a series of things that we need to do to get prepared so to look our very best and figure out how we're going to celebrate these birthdays. Yes,
100%.
So talk to me about the people that you see on social media. You're a good social media girl and you're seeing all these changes.
So I like to kind of see, you know, there's certain people that I really look up to and I really value what they're putting out. You know, most of them are overseas. And I'm very curious what's going on over there. But then I feel like there's also a lot of people, surgeons mostly, that are very vocal about things like biostimulators and all therapy and Morpheus and different type of skin tightening because, you know, it makes it the perception that they're putting out, and it may be a major reality for them is when they're doing surgeries, right? Smaslets, things like that, that they're having a better time because they have biostimulators with tight knit collagen networks and all therapy that's really tightened up the SMAS for them. That makes the work a little hard when they have to go in there. And, you know, I have a lot of patients asking me because there's a lot of this being said. And my answer to that, and, you know, this is my opinion, is that if the average age thereabouts is about 60 for a facelift, normally they're doing a deep plane under the muscle, not just fast. So the sculptor doesn't go down that far. Right? The other thing is that if 40 is when I'm really starting to want to correct some things, and I know I'm probably not going to afford to or plan for a facelift into hopefully 60-ish. Do I want to look like I'm falling and have no collagen support and not any type of lift because I want to save a surgeon 30 minutes of time during a surgery? That's my answer to them. You're getting paid a lot of money, work it out. Because from 40 to 60, we're going to keep them high and tight with our modalities, whatever is comfortable for them, and keeping them natural until it's time for their scope.
Yeah, and look, I don't have any comments with facelifts. I think there's definitely a lot of candidates that need facelifts, so I'm to be honest with. But I think what they don't realize when they get a facelift is they still require fillers and Botox afterwards. And in their mind, they really think, once I get this cut, it's gone. But they didn't get volume or the fat racking went away. And obviously they still have full movement and they still require tox. And I kind of feel bad because they get mad at me when they say, I still need Botox and filler after my facelift. I'm like, well, that should have been discussed.
Yeah. Well, that goes back to the fact that your skull is still this small now, when it was larger before. It was thicker before. Your bone was more dense. So when you pulled everything tight, you have a smaller framework. It still needs to be shaped a little bit underneath and maintained. It's not one and done. And the average time that a facelift lasts is 6 years. Yes. So, you still are going to need to have a good injector that is going to keep you looking natural and protect your investment of what you've already accomplished with your face.
I agree. You mentioned quickly the GLP-1s, and we talk about the volume loss on face. I think the hard part for me when I have my weight loss patients is making them understand that they should inject throughout their journey and not wait till they're 30 pounds down, because now it's going to make my job a lot harder. I have to tighten the skin. I have to do a lot more fillers than doing small little maintenance tweaks throughout their journey and not waiting till they're completely hyperviolet.
Yes. And the other thing is that when they're doing GLP-1s, yes, we need to do some volume replacement and keep an eye on where things need to be tweaked, but also they have to take care of their skin. Skin pen, microneedling of exosomes, keeping up with hydration and all of that kind of stuff is really important for the quality of the skin as well when you're on GLP-1s. Doing things, probiotics, ginger, like internally intaking things that are going to give you some reprieve, because gut health is important for what is happening in your face. And GLP-1s slow down GI motility. You're intaking less nutrients, less calories. You're training yourself to have less portion size, which is great. And so it's very effective, but you have to do the other support to make sure that how you're manifesting and what your appearance is looking like is supported. And that starts even with what you take nutritionally.
Oh, look, I'm a big multivitamin fan, right? I keep my multivitamin in the refrigerator. It's all natural. We don't eat well enough. We don't take in enough protein as women, and we definitely don't have enough vitamins in all of our food. The other thing I think, which is really unique that we get to do, is not only do we get to talk to them aesthetically, but figure out how the wellness takes part of the aesthetics, right? So I love to explain to patients, as we age, some of that loss of brow laterally could be hypothyroidism, right? Increased wrinkles, smoker lines is decreased estrogen. Increased skin laxity and cellulite is loss of testosterone, right? And so we get to have this conversation, understanding our nutrition, our vitamins, and our biogenic hormones that sometimes they don't want to hear about. Oh, no. They like, oh, I don't need that. And I'm like, why would you not need that?
Right. Well, that's also because of what happens with primary care providers, OB/GYN providers that just are not telling them, like, hey, go and look into that, see what you come up with that provider who's an anti-aging provider like you, and then bring it back to me. And then, because a lot of times they're steering them away from it and they're making them a little afraid or leery about delving into anti-aging medicine because they don't understand it themselves.
It is unfortunate when we're in med school, they don't talk about wellness and they don't talk about any metabolic medicine. I'm hoping in today's day, now granted I did about 20 years ago, that the newer generation is hopefully being taught a little bit more. I haven't really seen that come to play. I think a lot of us need to go back and re-educate ourselves. And look, we were just talking about, I just downloaded 6 more CME courses that I'm going to make everyone watch with me about wellness. And it's because it's forever changing. And we need to be that forefront. We need to let people know, look, it's for us, I think it's easier to make people look very useful and beautiful. And it's a lot harder to make them feel well because they need to take a really big part in the wellness aspect. They need to be part of this journey with us more than just showing up with their face.
Yes, that is really true. I'm going to have to use that, I think.
Right? Yeah. Right, because I tell them, I go, when I start your bioidentical hormones and I start your treatments, right, I need you to be compliant. I need you to take your medication on time. I need your refill on time. As you can see, I kind of look at her too, because we're also conflated with our treatments sometimes. We need to follow up with our lab work. We need to see what's changes are going on, because it's okay not to feel well for a short period of time, but we need to own that and we need to turn that around and make ourselves feel the best that we can.
You're right.
I just yelled at her this morning about taking her medication, so it's okay.
Yeah, she did.
We all do it.
That would keep me in line.
We all do it. So look, this is all really important. That bioidentical world is something that we need to approach patients. We need to let them know. So my biggest pet peeve, and I've seen it way too often, is almost all of us when we start going through menopause and we can't sleep and we become more anxious and we just don't feel well and we're putting on the pounds, is that the primary care physicians say, that's normal part of aging and that's normal part of menopause. Here's a benzo to fall asleep. Here's an antidepressant that's going to make you gain another 10 pounds. But that's just the way it is. And that really hurts my feelings.
Yeah, it's true. We're just too far in medicine to have to tolerate just that. And I mean, you know, listen, pharma is a business. You know, antidepressants, anti-anxiety medicine, mood stabilizers, all of that have their place with mental health for sure. But when you know somebody is physically changed, they're going through perimenopause and menopause and they're having major fluctuations, it's just the way it is now. We don't have to deal with that. I always think of Sex and the City, the movie, when they try to take Samantha's phone in the airport and she has an utter meltdown. And I probably watched that movie, I don't know how many times or how many years ago. And now that I'm on the HRT, I would be the same way. And they're like, what? You cannot take this. So, and it's transformative. And it's available and it works and it's safe. Of course, you have to pick the right person. You have to have a negative grandma. You need to make sure you're back in negative. You have to go through a screening. We're doing EKGs. We're doing lab works. We're doing a full, comprehensive and safe, diagnostic to figure out, are you a candidate for this? But to say this is just a normal part of aging, we're past that now.
We really are. And look, there are so many good studies out right now for everything, that estrogen is actually great for your health, that testosterone will actually improve longevity of life along with vitamin D. There's so many things that I think back in the old days, they had those bad studies with the bad type of estrogen and the bad type of progestin, and nobody's really come back. And now there's amazing studies in JAMA. There was a great study that really showed that estrogen actually improved quality of life and did not increase cancer. Because I get that a lot from our OBGYNs telling my patients that they really shouldn't be on these hormones and that I'm causing them damage. And I can tell you, as a breast cancer survivor, I would be on hormones the rest of my life if I could, because I truly believe it improves my longevity of life and improves my health. These are hormones we've had our entire lives and have done extremely well with it, right? We're youthful, we're energetic. And as we get older, all of a sudden, it's decided that it's terrible for you.
Yeah. No. We don't have to deal with that.
We don't. We need to feel good. We don't. We need to look our best. A lot of my guests talk about the shame, that people are shamed because they want to come in and do Botox and fillers and take care of themselves. But I almost think it's the opposite. I almost think like, man, why would we not want to feel good?
Yeah. I just think that if you can and you educate yourself and you go to someone who's safe, there's no reason why you shouldn't. There isn't. No.
Right. This is fun. You got to tell me, what if you had to give advice to the patients out there to know when they come in, right? Because they never kind of know, and we do pretty comprehensive consultations.
Yes.
And we never want to overwhelm people. I always tell you to look, I don't want to give you everything that you can do, because then you leave overwhelmed and you don't want to do anything, right? I try to pick one or two things from the work on. But realistically, what kind of inspirational stuff can we give to our patients to understand that this is all natural and this is okay to take care of ourselves?
I would say one of the things I do commonly with my patients is I self-disclose. Like, I've been there. I had melasma that was a perfect mother's mask that I had to blast back in 2016. And I did several lasers, and I went on Obagi Muderm system for 6 months, and I did the retinol, and then I went on Keytruda. Like, I tell them what I did to get to here. My skin was horrible. I had hollow temples, like 2 ice cream scoopers took them out. I mean, I went through, those type of changes in my face, and you look at me and you tell me, do I look natural? Do I look like I'm aging gracefully? And a lot of my friends are saying you're aging backwards. And it's because I'm doing things tastefully, safely, in the right sequence. I'm doing the internal work with the BHRT and the nutraceuticals and all that kind of stuff. And I feel better now than I did when I was, 38. So I think just self-disclosure to make them feel comfortable, like, I've been in your shoes, I know.
I agree. I think we have to tell them, right? I think when they look at us, and I use you as an example all the time. Well, you're so sweet, but I always tell people your best injectables are undetectable.
Yes, 100%.
I want you to leave out of here and everyone thinks you just got a new hair color and you like new hair did, or you got something amazing, or you got some sleep. Yeah. Whatever you did is working. Or I tell people, just tell me you had an amazing facial. You never have to tell them I even inject if you don't want to, right? Yeah. But there should be no shame. We just want to look and feel our very best. And I think that's okay. In today's world, I see the young girls coming in and doing preventative stuff and I kind of smirk at first because I'm old school. I was like, oh my God, you're too young. But now I realize, wow, if I would even start a little bit younger, right? The things that I could have prevented in doing it, I almost look up to these young girls doing these things.
Yeah, no, a lot of times when the other girls come in and they want to do a lip flip or something, like just to test it out, I always tell them, like, Botox does not feel like the lip flip is the most spicy area. Yeah, spicy. And so I always say, don't judge Botox. So when you come in on, your latter years, don't not get it up here because you think this hurts so much. Because Botox in the lip is pretty spicy. And I know we use a cryotriller and we get them really nice and cold and numb, things like that. But I mean, to me, starting when you first start to see those signs and then educating yourself on nutrition to help prevent this is the absolute best. I'm happy to do like micro talks or baby talks. There's a bunch of different meals for it. And I still educate them about the face, about the difference between standing lines and dynamic lines. And we're not trying to freeze you. We're just trying to make you a little bit less dynamic so we're not etching in ragtides or wrinkles.
And I think the only advice I would give to the young people is don't do everything you see on TikTok. I think there's a lot of bad fads out there that could potentially cause you to look more aged as you get older. The one that literally is dissolving this area here so that you can look thinner now.
All fat removal was horrible.
Terrible. When you get older, it's going to be a problem. You're going to have to have fat put back in. And so again, look natural, do little things, get your facials, get your stuff. But don't do the crazy things on TikTok that you're seeing. Don't follow the trends. Go to an experienced injector and get their advice and do no harm, right? We're always at do no harm no matter what we do.
Yes, 100%. Tell me about what your feeling is. I'm asking you questions. I like to pop one in. When you have a patient that comes into you, that's a new patient that was getting work somewhere else and they're overfilled and they have migration and all the things, how do you deal with corrective patients?
Well, I do know. I take a different approach. I think a lot of injectors just dissolve everybody else's work and restart. I sometimes feel really guilty about that because I know that they spent a lot of money doing that. And so what I try to tell them is I'm going to try my very hard is not to dissolve everything. And I will dissolve little bits everywhere. So I like to dissolve the tear troughs where they have a lot of bagging in there. I like to dissolve, obviously, everything that's out of vermilion border. Or if they're very bumpy, I dissolve sporadically versus dissolving everything and starting again, knowing that that might take them a little bit of time longer, and then taking a little bit of filler and repositioning everywhere where it can blend a little bit better, right? I always tell people you don't need to look really sharp and look like you have a lot of fillers. I need to blend it out smoothly. But that's really hard because I respect that they spent so much money and now I'm telling them, or they're very upset that they have this filler done and they're like, what can I do without removing it all? So unless it's really outrageous, I try to blend it a little bit better with small amounts of remover. I just remove what I don't like and what they don't like.
Yeah. I love doing corrective work. It's kind of a fun challenge. Yes. I like the challenges. Like I have, the cleft palate that I did. A lot of those little rhinoplasties for people that have had like, and I've repaired dog bites to the lip or, it's just like anything that's like somebody that's had trauma or something that's like hurt them emotionally and they want to correct this, and then to see them look at themselves and it's corrected and they cry, I cry, or it's corrected.
And facial lip palsies are really fun.
Yes, that too. What I do like about the new trend of Botox, we're putting it like around the temporalis area to kind of lift. I was doing that for migraine, and I love that look when you start getting Botox around here just to kind of lift that up. It's such a nice surprise.
Yeah, and I don't think people know that all the great areas that you can do tops and the always and all the little,
like it's just
We eat a lot, and it's artistic. Yeah, it's artistic. Yeah. So this week we've had everyone come in with big masseters, and they're grinding, and they're having headaches, and nobody really had the conversation that they can treat their masseters and really help them. And so there's so many medical things that we could do. I mean, we both love our trap talks. I have a lot of pain in my nap, and I think that will help our headaches and getting us to feel a little bit better. So but there's so many things that we can do, and I think this really helps. This episodes help people understand that there's no one right way of getting to an answer, but I think that they need to go and find a provider that they trust, that they can come up with a treatment plan that's going to work for them, that's going to be realistic.
I agree.
So, I have to ask you our last question. Okay. And that is, what does beauty mean to you?
I coach, it's an inside job.
It is an inside job.
I think it's your personality. It's how you present to the world. Part of presenting to the world is making your outer appearance look better so you feel better. But I really think it's the way you come across, the way you treat people, your energy, your vibe, the aura that precedes you. And it comes from a place of gratitude. When you're grateful, like I'm grateful for you, I'm grateful to be doing what I love because I spent 20 years in critical care, like to the walls and doing all the crazy things. And I mean, I've been doing this for 14 years now in aesthetics on the side and, kind of graduating to doing it full time. I am so grateful to have let go of that critical element and just focus on the artistic piece and what I love and just take that leap and making other people feel beautiful. And I think because I'm doing what I love, that inside job where I just let that security blanket of working in a hospital and actually fulfilling what I want to do, I think that comes across and it makes me more beautiful because I know I'm happy at what I'm doing. And I think that goes for anyone, whatever they're doing in their career, if they're fulfilling their purpose, it comes out. And then, we do the party things in the face, but it's really an inside job.
Yeah, I agree. Loving ourselves inside out and feeling great is definitely a great thing of beauty. Thank you again for coming in, for sharing your stories, for us helping, I think, our patients understand a little bit of what's in our worlds, which we love so much. And we've been very, very blessed to be in this field. So we are. Thank you so much for coming in.
Thank you for having me, Elise.